Johnson?
All right, how you doing?
Hi, good afternoon. My name is Dustin Garon from RT. I'm going to go ahead and, they told me that you wanted to speak to me about your father?
Yeah.
Okay. So I know that you, can you please give me your full name and your date of birth? And then can you verify your father's information?
Dee Johnson.
Okay, and what's the date of birth?
His birthday 09/26/1946.
Okay, and what's yours, please?
Mine's 04/26/1986.
Okay. So I did look, so thank you for verifying that information. The reason why I did that is because I looked through your father's paperwork and then I noticed that you're his power of attorney, correct? So the reason why I'm doing this is just for your father's personal health records. Is this law that we have HIPAA. It protects our patient's privacy, okay? So I just wanted to make sure that it was you, that it was okay. Your father has signed this and I just wanted to make sure that it's okay that I speak to you about his health care, okay? So, can I ask you, what language do you prefer me give you some information in?
English will be fine.
English? Okay. And then, are you more of a visual learner or examples, or how do you learn?
Both visual will do.
Okay. So I went ahead and I printed out some paperwork for you. It's actually in English, and it has some pictures on it for you, okay? And some examples of the medication that I'm going to go ahead and talk to you about. So my nurse told me that you were worried about your father because you were concerned with his health. You came in today and you saw him, and obviously it was a little bit concerning and alarming that your father's kind of has a lot of tubes on him, and you were just.
Yeah, I was just actually wondering where were all the tubes and why he couldn't talk.
Okay. So what happened with your father is, I'm not sure if you've ever heard of this disease. It's called Guillain-Barré syndrome. Have you ever heard of this? No. Okay. So this is a very rare disease. And unfortunately, it affects people. It's an autoimmune system. Our body attacks itself. In your father's case, it was attacking his nerves. So what happened was that it starts affecting from the ground up. So going from your feet, moving up. So tell me a little bit. Did your father have a flu or get sick before this?
Yeah, he's been having a flu lately, cough, trouble breathing lately.
Okay. So yeah, so this disease, after some research, we've noticed that it's common after the flu. And your father was telling us in the medical history, and I also saw that you were giving some reports to the nurse saying that this started maybe about 3-4 weeks ago, and he had started having difficulty walking, and then it led to difficulty breathing, correct?
It's been very weak lately.
Okay, and is this usually your father? He's very active?
He's very active.
Okay, so what happened here is that what Guillain-Barré syndrome is, it starts to weaken our muscles, because like I said, our body's attacking itself. And it starts from the ground up, and it's gotten to the point where it's reaching your father's diaphragm. Our diaphragm is like a dome-shaped muscle that is here. It's right underneath our ribs, and it does it's our biggest muscle of breathing, and that does 90% of our breathing. So as this Guillain-Barré syndrome is progressing, it's paralyzing this. So that's why it was becoming difficult for your father to breathe. At this time, we wanted to make sure that he was okay and that he's going to be stable. We're trying to save his life.
Will he be in any pain?
Right now, he's not in any pain. So what I'm gonna go ahead and explain to you, I also printed a list of the medications. So we use the medication called Versed for your dad, which is a benzodiazepine. You don't have to worry about that. Just giving you some overall information. It's the class of medication, and this is like a sedation, so it kind of made him go to sleep. So he's not feeling anything. What we did is intubate him. We used an intubation tube, and we put it in his trachea, and we're helping him breathe for now. Since he's paralyzed, we want to make sure that he's breathing.
What's paralyzed with?
We paralyzed him with a medication called acetylcholine, which is depolarizing paralytic medication. And this just helped us paralyze him so he's not in pain and he's not moving, so we can go ahead and position the ET tube in the correct place it should be, which is in the trachea. We also use rocuronium, which is a medication to paralyze him for a long period of time because we don't know exactly with certainty how much time he's going to be sedated for. Of course, we have him sedated with the tube because if you wake up and you kind of have been sedated for a long period of time or a couple of days, if you wake up, your first reaction, you have all these things in your mouth, your first reaction is going to be to pull everything out. We don't want him to do that because he is paralyzed. We don't want to jeopardize his health or his life at this point.
So you have like no idea how long he'll be intubated?
At this point, we really don't know. Some people recover from this within a couple months. I've heard of some cases up to a year. But at this point, we're gonna keep doing tests on him. We're gonna keep monitoring him, making sure that he's okay on a daily basis, just to make sure that he's stable. And as soon as he's able to come out of this, by giving him medication and antibiotics, and the doctor has developed the whole plan for him, then we're gonna go ahead and extubate him or take the tubes out. But at this point, I can't let you know when that will be.
So this all started from a diaphragm?
This all started because, yes, so it all started because his autoimmune started attacking itself due to this disease, Guillain-Barré syndrome. And like I said, it started to work its way up, and as it went up, yes, it did paralyze his, it started to paralyze his diaphragm. It wasn't fully paralyzed because he was already breathing, but he was still breathing, but he was having difficulty breathing. That's why he was having the shortness of breath. That's why he was hanging on. I don't know if you saw that he was, when he was breathing, he was going like this. So these are called our accessory muscles. So he was going and he was using this. When we see this, we see that the patient's having clear view that he's having some difficulty breathing. So, okay, so now I'm gonna go ahead and give you this information.
Okay.
And then I just have a few questions for you because I know your mom might ask you, but I know she went home. So if your mom asks you what medications is your father on, or what was he placed on, if, you know, she might be concerned, is he in pain? What are you gonna tell her? What did you learn today?
Well, I learned that gave him Versed to sedate him,
Yes.
relax him. Also gave him a acetylcholine to paralyze him,
Yes,
so that you can intubate him.
correct.
I guess just to keep him sleeping and comfortable right now, we gave him a rocuronium.
Rocuronium, correct?
Okay.
Very good pronunciation.
Try. It sounds like rocuronium.
That's fine.
Yeah, and just explain to her that the Guillain syndrome.
Guillain-Barré, yes.
Guillain-Barré.
And then I also gave you some information here on what it is.
Okay.
Just so you can go ahead and read about it a little bit more. And if, you know, if your mom or your family members, if you wish to share that information with them, you can go ahead and just have a little bit more knowledge about what that is.
Okay, I appreciate that.
No problem. Do you have any additional questions for me?
This is it. This will be it. I can take these with me.
Yes,
also?
this is for
Okay.
you, and on here, I went ahead and I wrote my phone number and my email address in case you do think of any other questions you want to ask me or your family does. And you can just go ahead and give me a call. If I don't answer, just leave me a detailed message. I might be with a few other patients, or you can email me and I will answer you back as soon as I can.
Thank you.
Okay, no
Appreciate
problem.
it.
A pleasure to meet you.
All right.
And if you do have any other questions, please don't hesitate to contact me. And like I said, we'll do the best to provide the service for your father. And if you guys have any questions, just let us know.
Thank you for taking
Okay.
so much good
No
care.
problem. Thank you
All
so much. Have a nice day.
Thank you.